All right, we're back. We're back. We managed to get back. How you been, Susan?
I've been doing great, Mike. Thanks for asking.
Yeah, as long as we stay busy and stay out of trouble.
That's good.
So we're going to get back on topic. We haven't heard from any of our viewers yet, but I'm sure we will.
Absolutely.
Very, very soon. I guess we go over again, who can we expect as future facilitators for what you're trying to do and get the organization off the ground?
Our idea in the Creative Community Resources is to inform, educate, and collaborate. So we'll be looking at co-facilitators that'll help educate and inform the public by helping each individual to recognize the strength of working locally and these programs that are most ethical, legally, humanistically, and for financial best option of resources. Some communities offer mentoring and offer transitional situations, and local community resources is our real emphasis with faith-based.
Well, that's something that's nobody knows about.
Right.
And it's important if we can get that information out there and have a place like we can do this now on this show.
Right. To
announce ourselves that we're here and we're ready to listen and help all that we could possibly help.
Yes.
And the mission, we've covered that briefly in the last session, but
that is community resources, what's out there, how you find it, if it's a good fit, and how you collaborate with other communities and find long-term success.
And the areas that we're looking forward to learning more about and growing with that are listed in some of these categories.
Absolutely. We want to look at medical, elderly, psychological, legal, personal, and I know Vicki, she's not here today, but she has a great passion for our vets.
Well, they need a lot of help.
Absolutely.
Luckily, the VA has been very, very good with,
yes.
with the veterans. I'm a veteran, and I get help from the VA when
yes.
I need it. And there's very few questions asked.
Right.
But I don't want to say but I'm going to. Sometimes they have to be probed a little bit as well.
I call it coached, yeah. We want to help explore all the options out there and best solutions.
And you mentioned Vicki with working with veterans. Her and I have worked with veterans
yes.
for quite a while. And we're having a meeting tonight at a location where there'll be veterans there to help us out.
Correct.
And,
yes.
and I'm so excited about that.
Collaboration's always a good thing.
It is, because they have ideas that we couldn't comprehend.
Correct.
I mean, I can get some of them because I'm a veteran.
Right.
Vicki's got no idea.
Right.
And she's learning them very fast.
Well, if we're in the civilian life, we're not always aware of what all those needs are.
And it's interesting, the work and the, how do I want to say this, the structured organization of veterans
yes.
is so much different than civilians that have never been in the military.
It's very institutionalized, and if you don't understand the process, it can be overwhelming and very confusing.
Well, I know several veterans that when they get, like when I went in, I didn't have to know anything. Everything was black and white.
Right.
Do this, do that, don't do this, don't do that. No questions, no negotiating, doing anything like that. And that takes a little bit to get adjusted to.
Yes, it does.
And we're trying to help the veterans to be patient.
Yes.
Yep. So where do you start to find the services, and who do you contact? And are there specific locations, or do they change, and is it going to cost?
There's all different resources, and that's the variation. Some programs are federal and some are state. They're all administered through the local communities somewhat differently, and sometimes easier to locate and access than others.
Yeah, and that's the thing too, because they're spread all around.
Yes.
And veterans don't gather in pockets of places around the United States. They live all over the United States.
Correct. And so do our elderly and all of our other individuals who need medical assistance. And some communities are very self-determination friendly, and we have elderly with a lot of senior services. There's other areas that are more probate friendly and like to see more institutionalization.
Okay. And that can help a lot to senior
Yes.
veterans, yeah. So, do you want to go over, or have we covered it enough about where to start to find these services? I know you're a good contact person for this.
I'm a good contact in my area. Vicky's a great resource, as well as you probably in your area. And each community should have contact points that could be referenced and referred to, yes.
Okay. And these individual programs that are run by different organizations, who actually runs these programs?
Well, those are good questions you'll want to be sure to ask and understand. If these programs are state, federal funded, how they're funded, if they're a nonprofit and they're by donation, or whether they're by grant and it's for a specific purpose. What's the criteria for professionals or volunteers? Are they local community services? Is it faith-based? You know, what's the expectation? What's the offering? And what do you?
We got a little bit of time left here, but is there could there be a conflict between local and federal trying to get these services for these veterans?
Well, the definition of disability varies in Michigan from federal, and that'll be a whole topic area we can probably get into. It's interesting whether you're talking court forms for an MC70 or veteran benefits or elderly definitions, what a disability is, what a vulnerable individual is, and what the definitions are federally versus in the state of Michigan or in a community.
Okay, well, we've got to wind it up. That was our little signal that we went over our time a little bit.
Okay, that went quick.
Yeah, that went very fast. So we'll get back here again soon and give you some more information.
And if anybody wants to add any comments, they're welcome to contact Michigan Probate Services 101@gmail.com. We're open to topics, suggestions, and questions.
Good, thank you. Well, I hope